Hi, my name is Nerissa, and I will be a nurse for today. Can you please get your name and date of birth?
Mr. Valentine, January 28th, 1968.
Okay, good. I'm just going to do some hand hygiene. Is this a good time and location for you to learn about these drugs today?
No, it's really loud.
Okay, let's go. You want to go to another room?
Yeah.
Okay. Also, do you have any barriers that will stop you from learning about these drugs today?
Yeah, I left my glasses at home, and I'm farsighted, so I can't see up close. I can only see far.
Okay. So I have some stuff here that will help you see when they get time. Do you also have any cultural considerations?
No.
Okay. So to begin, I'll teach you about metoprolol, and I know you already learned about your insulin medications, correct?
Yeah, I learned about insulin.
Okay. So I'll just be teaching you about metoprolol. The brand name's also called Lipressa or Toprol XL. It's usually used interchangeably, just in case if you see Lipressa, you know it's metoprolol. It's used for prevention of any further heart attacks, because you recently had one, correct? So what it does is it lowers your heart rate, your blood pressure, and it reduces your cardiac workload, so your heart doesn't have to work as hard to pump blood out. So because you are taking metoprolol and lisinopril, you are at a risk for falls related to your current medication use, the two drugs, as manifested by your low heart rate and your low blood pressure. So to combat that, we have 3 short-term goals for you to accomplish while you're at the hospital. So I'm gonna just go over them with you, okay?
Okay.
So the first one is we want you to wear slip socks whenever you get out of the bed, because the floors could be slippery, so we don't want you to slip and fall. So every single time, please, I would ask for you to wear the slip socks. Also, every single time you want to get out of the bed to go to the bathroom or anything, just press your call light. Have one of us, or the nurse assistant, come and help you, just to monitor you while you're here, okay? And also, before you leave, because you do live at home alone in the apartment, right?
Yeah.
So we want you to teach back to us 3 strategies that you have learned here that will help prevent any falls, just safety measures that you learned to take at home, okay? So metoprolol, since you are taking another antihypertensive medication, they do interact, and it could drop your heart rate pretty low, and you already have pretty low heart rate. So we just want you to monitor that, because you can get dizzy, and if you get up suddenly out of bed, just get up slowly, because it can drop your blood pressure really low. So just monitor that. Any dizziness, just take a second to deep breathe before, okay?
Okay.
Another major side effect that I would like for you to monitor is, since you are diabetic, you are at risk for hypoglycemia, and this drug will mask that. So you won't know that you have hypoglycemia. So just regularly check your blood sugars, just in case, because it can drop and you won't have any symptoms. So just watch out for that. Those are the major things that I would like for you to watch out for. Also, alcohol. Alcohol will decrease the effects of metoprolol, so I would prefer you not to drink any at all.
Okay.
So you are prescribed 25 milligrams, 1 tablet daily, every single day. You cannot stop this drug abruptly, because it will cause rebound hypertension, which is when your blood pressure spikes, and that is serious. So do not stop it abruptly. It will raise your blood pressure and your heart rate pretty significantly, and you can get another heart attack. So take it consistently every morning with 25 grams, 1 tablet daily, okay? Do you have any questions about metoprolol, what I've told you so far?
No.
Okay. If you do have any questions, just feel free to contact your provider, ask him whatever you need to ask, like if it's not working or just anything, okay?
Okay.
Since you already learned about insulin, I'm not gonna really talk too much about it, but you are taking insulin glargine for your hyperglycemia. It's also called Lantus, if you also see that brand name.
Okay.
You take 10 units subcutaneously at noontime every single day. And your insulin Lispro, you're taking 40 units subcutaneously before every meal and before bedtime. Okay? It's just for your hyperglycemia, because you were taking metformin at 500 milligrams at home, and it wasn't working, or it wasn't efficient. So now you have these 2 medications.
Okay.
Do you have any questions before we begin the injection portion?
No.
Okay. So to start, you always want to make sure you have a clean surface, and you want to take out your vial of medication about 10 minutes before you inject yourself, so you're not injecting cold medication. So after doing hand hygiene, I'm gonna put some gloves on because I'm gonna be teaching you. But once you're at home, you just need to use hand sanitizer. Okay?
Okay.
Okay. So first, to begin, you want to rub the medication in between your hands to mix it. Okay. And then you're going to clean the vial off with an alcohol swab. Okay. Put that to the side. And you're going to be using a 30 units syringe. Make sure it's an orange cap. Orange cap's always insulin. The gauge is 25 to 31, and the needle size is 5/16 to half an inch. Always, okay? You will only be using 10 units, so this is why we prefer to use the smallest needle possible, which is 30 units. So to begin, you're gonna uncap it, and then you're gonna draw up 10 units of air. Okay, and then you're just going to inject the needle into the vial and then inject the air. And then you want to flip it up, but make sure you don't bend around the needle too much, because then you'll have a bent needle. And then you will draw up 10 units of insulin, remove the needle. And if you do have any bubbles, you just want to give it a quick flick to get any of the air bubbles out. And then you want to recap it, but you don't want to just put the cap on it, because then you could accidentally stick yourself. You just want to use a scoop method and put the needle into the cap, and then once the needle is fully covered with the cap, you close it.
Okay.
So now we're going to talk about sites. You do have a couple sites that you could use. Since you're doing it subcutaneously, you could use your stomach preferably, because that's where it absorbs the quickest. But if you don't want to use your stomach, you can use the back of your arms or the outer parts of your thighs, the fatty areas. You also want to change sites. You can go counterclockwise or whatever way you want, but you want to make sure you change sites, because you can get tissue damage. Okay?
Okay.
So we're just going to clean the skin. And then you want to make sure you let the alcohol dry a little bit, because if you don't, then it can sting you when you go to inject yourself. And you want to pinch, first you want to uncap the needle. And you want to pinch about 1 to 3 inches of fat. So just like this is about 1 to 3 inches. And then you want to go at a 45 to 90 degree angle. So you're just going to go slightly like this. And then you want to inject the solution slowly. And then you want to release the fat and take the needle out. Okay? And you never want to recap the needle because you could accidentally go and use it again. So you always want to make sure you dispose of it into a sharps container. Just because, so you don't accidentally use it again. If you don't have one at home, you could always go to your local Walmart or anything and get you a sharps container. Okay? So now, do you have any questions about what I taught you?
No.
Okay, so now I'm just gonna have you teach me how to do an injection. Okay, there's that. You have your alcohol pads.
Yeah.
Okay.
I do.
Here's your needle.
Okay.
And here's your injection. So what are you gonna do first? I also have your magnifying glass so you can see better once you're injecting.
Okay, so I'm gonna perform hand hygiene.
Okay.
I'm gonna make sure the surface is clean.
Okay.
Okay, and first I'm going to take an alcohol swab and clean the top of the vial.
Okay.
Okay, I'm gonna clean it. Okay, put that down, and I'm going to uncap the needle.
Okay.
And then I'm going to draw up 10 units.
Yes.
I can't see. Okay, so I drew up 10, and then I'm gonna go into the vial. Okay,
Nice.
I'm gonna inject the air.
And you could see this, right?
Yeah, I can see. Okay, and I'm gonna flip the vial over. This is good, that's good.
Okay.
And then I'm going to draw 10 units of the insulin, and then I'm going to take the vial off, and then I'm going to flick it.
Yes. And what are you doing that for?
I think removing air bubbles.
Yes.
Okay, and then I'm going to cap this using the scoop method.
Okay.
Okay, and then I'm going to take another alcohol swab pad and wipe the areas that I can put these on my body.
And what are those areas that I mentioned?
The sides of my arms,
back here,
and then the back of my
the sides of
my leg,
and then your stomach,
and my stomach.
Yes.
Yeah. Okay, I'm gonna put this down. Okay, and then I'm going to uncap the needle, and I have to pinch the skin, wait for the alcohol to dry, and at a 45-degree angle, I'm gonna go in and inject the 10 units.
Okay, good job.
And then I'm going to remove the needle.
You're gonna release the fat first.
Release the fat, and then remove the needle. And then I don't recap. I put it in a sharps container.
Yes, and then I'll put that in the sharps container for you.
Okay, and then I'm going to
just clean off
the area.
Yes.
Okay, is that it?
Good job. Yes. So it looks like you learned how to inject your medication pretty well. Also, if you have any questions when you're at home, if you forget anything, please feel free to call the provider and ask him whatever you need to ask him. I also forgot to mention with the metoprolol, once you're taking it, you want to monitor your pulse and your blood pressure. So if your pulse drops below 60 beats per minute, you want to stop it. And if your blood pressure drops below 100, don't take the medication.
Okay.
So do you have any questions?
No.
All right, thank you.